So let me take this opportunity to welcome everyone to the April 28th, 2020 special meeting of the Mecklenburg County Board of County Commissioners. The purpose of this meeting, this special meeting, is to receive an update from our representative, Congresswoman Alma Adams, regarding the COVID-19 response efforts. Due to the ongoing COVID-19 stay in place, state and local state of emergency declaration, the board is again meeting remotely. This meeting is scheduled to be held from 1 p.m. until 2 p.m., time certain. The board's public policy meeting will follow immediately, well, not immediately, but after the adjournment, which should be around 2:30. Okay. The public may join the following and follow the meeting by viewing on the web at mecnc.gov or follow us on Twitter. You may call in and listen to the meeting at 408-418-9388. Again, 408-418-9388 and enter the following access code: 714-941-986. Again, 714-941-986. Since we're meeting remotely, we will begin with each board member identifying him or herself so that the record will reflect who is present and participating in the meeting. I will introduce myself and then call upon each of my colleagues to do the same as I call out their respective districts. This process will allow the public to know who is present and participating, and also provide an accurate record for the clerk and the board minutes. So, I am George Dunlap. I am participating remotely. I represent the people of District 3, and I also have the privilege of serving as chair of the board. Next, I'll call on our vice chair.
Good afternoon. My name is Elaine Powell. I serve as County Commissioner for District 1 and also serve as Vice Chair. Thank you.
At-large Commissioner Pat Cotham.
Good afternoon. This is Pat Cotham, County Commissioner at Large.
At-large Commissioner Ella Scarborough.
Ella Scarborough, County Commissioner at Large.
And at-large Commissioner Trevor Fuller.
Good afternoon. This is Trevor Fuller, County Commissioner at Large, participating remotely.
District 2 Representative. District 2 Representative. Okay, we'll come back. District 4 Representative.
Good afternoon, everyone. This is Mark Jarrell, participating remotely, and I represent District 4.
District 5 Representative.
Good afternoon. This is Susan Harden, and I represent District 5.
District 6 Representative.
Good afternoon. This is Commissioner Susan Rodriguez McDowell, elected by the people of District 6, participating remotely.
Again, District 2 Representative. Okay, let the records reflect that there are 8 out of 9 present. The commissioners have acknowledged their presence for the meeting. Therefore, we have a quorum.
Hello, are you hearing me?
Commissioner Leak, if you'll go ahead and introduce yourself.
Okay, this is Commissioner Leak, District 2. Can you hear me?
Yes.
This is Commissioner Leak, District 2, and I'm happy to represent the people of District 2 remotely.
All right, at this time, we'll introduce our clerk to the board.
Good afternoon, Emily Kunze, clerk to the board.
Our deputy clerk.
Good afternoon, this is Christine Smith, deputy clerk.
Our county manager.
This is Dina DiOrio, Mecklenburg County manager.
And our county attorney.
Good afternoon, Tyrone Wade, county attorney.
All right, first, a few housekeeping rules. Since we are again conducting a remote meeting for this afternoon, There are a few rules that will govern our actions so that the board minutes are accurate and the actions are consistent with the law. If a commissioner wishes to leave the meeting, please ask for a point of personal privilege. The privilege that the minutes capture the actions and attendance of each member. When a commissioner returns, please announce your return as soon as you have the opportunity to do so. Since there are no action items on the agenda this afternoon, the board will only receive updates on matters on the agenda only. However, in order that the records and minutes are accurate, it is necessary that we recognize each commissioner and ask whether they have comments. Please wait to be recognized by the chair before speaking and refrain from speaking over one another. May I also suggest that each speaker end his or her comments by saying, "This concludes my comments," or please state, "I have no comments," or "I do not wish to speak on the matter," if you don't want to comment. May I also ask my colleagues to be careful of the volume when speaking into the mic on your computer. Staff has had some concerns with the technology. Most of them are wearing headphones, and so when you speak loudly, it hurts their ears. So I'd ask you to be careful about that as well. So all of you know that there are a lot of moving pieces related to the current COVID-19 crisis response, especially at the federal level. At our last meeting, we received an update from our county staff. Today, we'll hear briefly from Amber Harris, who is the Director of Government Affairs of the North Carolina Association of County Commissioners, and then directly from one of our representatives in Washington, D.C., Congresswoman Alma Adams. So for those who may not be familiar, the association has been working diligently with the members of the congressional delegation and counties across the state, holding calls such as ours today. We appreciate the association's ongoing commitment to advocating for counties in North Carolina. And so at this time, I would like to recognize Amber Harris, Director of Government Relations for the North Carolina Association of County Commissioners, for some brief comments. Welcome, Amber.
Thank you so much, Commissioner Dunlop. This is Amber Harris. I am the Director of Government Relations at NCACC, and I don't have a ton to say. Just thank you so much for including us on this call. We've been paying particular attention, more attention than usual, frankly, to what the federal government is up to, because so much of what they're doing is going to inform what the General Assembly does in terms of offering aid to counties in light of COVID-19. So I really appreciate Congresswoman Adams' attention to these issues and her time this afternoon. These calls and briefings have been really instructive to us. So thank you. And I don't have any further comments at this time.
Okay, thank you, Amber. We appreciate you coming to Mecklenburg County, even though it's virtual. Congresswoman Alma Adams.
Hear me?
Okay, we're getting a lot of feedback.
Miss Adams, you have two connections going. You're going to have to turn one of them off.
What about now? What's going on?
Okay, does she need some assistance?
Miss Adams, try turning your volume down.
Is that better?
That's much better.
Can you all hear me? Can you hear me?
I can hear.
I mean, is it loud enough?
Ms. Adams, you want to start again with your introduction?
Okay. First of all, let me thank you for the opportunity to join you today. I have the privilege of representing the 12th district here in Mecklenburg County. I want to thank you for all of the assistance that you have given to our Congress, particularly since we are involved with COVID-19. It has changed life as we know it. Since the beginning of the crisis, we lost 289 North Carolinians to COVID-19. Over 500,000 North Carolinians have lost their jobs. In Mecklenburg County alone, we've seen 43 people lose their lives in COVID-19, and we're experiencing a true national emergency. Our economy is in free fall, our hospitals are stretched to capacity, and our supply chains from food to medical equipment are experiencing unprecedented shocks. The people of our county demand and deserve help from their elected officials. So I am delighted to have been involved in helping through this process. I fought to be your best advocate on the federal level. And since this crisis presented us with the decision to shut down our economy, Congress has passed 3 comprehensive packages and a 4th interim package just last week to help soften the worst blows of this crisis. We've appropriated over $3 trillion to assist small businesses, working Americans, and to help our overburdened health system respond to this crisis. And that includes $659 billion for the SBA's Payroll Protection Program, which we know as the PPP, designed to help small businesses keep their employees on payroll. $260 billion for expanded unemployment insurance, and $30 billion in emergency education funding, including $396 million for the K-12 schools in this state. $75 billion for personal protective equipment for our hospital and frontline workers, and almost $30 billion for the only strategy that will bring us out of this crisis, and that is testing. I want you to know that we haven't finished our work, because I know that the fiscal pain that our states and localities are feeling, as well as weather our way through this crisis, as we weather our way through this crisis. So our state is facing a multi-billion-dollar revenue shortfall in the next fiscal year. And that means less money for our schools, for our public health services, and for programs that help our children and families put food on the table. You may have heard that the Senate Majority Leader said that the best option for our states and localities feeling the crunch is to let them go bankrupt. Well, he must not know how jurisdictions like Mecklenburg County are coordinating the response to this crisis. It is our county and state governments that are tracking new cases of COVID-19, putting into place guidelines that allow us to safely reopen. I want you to know that the next relief bill from Congress will include funding for our states and localities. You have my word that the word of all members of the House Democratic Caucus support that as well. Because in an emergency as unprecedented as this one, you rely on us to make sure that you have everything that you need to be as responsive as necessary. And so the least we can do is to be up for the challenge. I want you to know also that my office is and will always be a resource for you in this fight. I've sought to be as transparent and responsive to all of the residents of Mecklenburg County as this crisis unfolds. We've had 2 virtual town halls. I've made my website an open resource for anyone seeking information on COVID-19 and how to access federal relief. And I'm taking any and all recommendations on how to best craft Congress's next relief package to help our community rebuild and be stronger than ever before. We're to you as you are to the 1.1 million people who live in Mecklenburg County. It was the author William Fetter who said that the prizes go to those who meet emergencies successfully. And the way to meet emergencies is to do each daily task the best that we can. Mr. Chairman, I appreciate the opportunity to speak with you today. My staff is on board to answer and address any questions or concerns that you may have that I may not be able to answer. So I yield back to you, and I have completed those remarks. Thank you.
Thank you, Congresswoman. We certainly appreciate your taking the time out to be with us today and to be able to answer questions and make your staff available to answer any questions or concerns that we have. So I want to get my time down. I think we have a total of 40 minutes. I know my fellow colleagues oftentimes have lots of questions. So to be fair with everybody, we're going to give you up to 7 minutes to ask your questions. And if there's time at the end, we'll come back for a second round. If not, then we'd ask you to put your questions in writing, send them to our clerk, and we will forward them to Congresswoman Adams. So we're going to start the questioning period a little bit different today. We're going to call on Commissioner Leak first for your questions.
Let me first say thank you to our Congresswoman. I sit in District 12 and very proud of your representation and what you do and have done over the years serving on the campus of Bennett College. All through the years, you have been a worker and a doer and a respecter of people. So my question is just specifically, how do we identify, how is Congress identifying small businesses? Are you there?
Yes, can you hear me?
Yes, ma'am.
Oh, okay. Well, first of all, we have defined our small businesses as, and there are probably many categories, but our small businesses are those that have with 500 and less. But what we've tried to do during this second round of PPP is to ensure that we would include those small mom and pops, those individual contractors, and individuals who may just have 2 or 3 employees as opposed to hundreds of employees. We've tried to adjust the current program that we just voted on last week, the 300 and, oh, actually it was almost $500 billion. 310 billion for the PPP was authorized under the CARES Act. We've set aside $60 billion for loans for smaller insured depository institutions. That would also include $30 billion specifically for minority banks, CDFIs, credit unions, community banks. Those are organizations that we feel have already a relationship with many of our small institutions who did not get in on this the first awarding of these dollars. And so we had concerns about it, and we want to make sure that whether you run a beauty salon, a barber shop, whether you have 2 or 3 employees, that you should have an opportunity to participate as well. So some people consider small businesses as 500 or more, and we're looking at those as well who have less than that so that everybody is included.
Thank you for that response, because I've had some concerns about small businesses as the mom and pops that we have. I can't think of a business in Mecklenburg County that's owned by a Black person that's 500 members or either 50 people working for them. And this is why I'm asking that question. It was asked to ask you that question. So you have responded, but I think we can do a better job at communicating what we are really trying to do and will do to help those who are mom and pop businesses as relates to the Black community. My second question deals with the monies available for education. North Carolina was once an educational state. So to hear them talk about from the state level and now from the national level that the budget will not be able to provide that's necessary for quality education for all children.
Well, let me just say that we have provided funding on this first CARES package that went to our state, and that money was funneled down into various communities. We will be doing on this second package, providing additional funding. The state right now has the responsibility for education. But of course, the federal government does provide some funding to the state, and we'll continue to do that. I agree with you as a former educator myself that is one of the most important investments we can make. So listen, you have my word that we'll continue to make sure that there is funding coming from your federal government for education. But I think in this particular situation, we must make sure that we work collectively with our state government to provide the funding that we need. We were not able to get the support to provide support to or funding to our localities during this emergency economic package that we just put together. But know that we're continuing to work on the next package, which probably will be trillions as well. And we will make sure that it addresses the needs of our local community and our states as well.
Let me ask, how much time do I have with my question? I'm sure that it did not include her responses.
According to my time, it's 1 minute and 34 seconds.
Thank you. My last question deals specifically with my senior citizens. As we have heard and listened, that those are the people who carry the load of suffering with the virus. I hope that we can say something that would impact and continue to support people who've carried the load of this country and the state of North Carolina and the county of Mecklenburg.
Yes, Ms. Leak, I certainly agree with you. And I want you to know that even in our first package and everyone that will complete after that, we will make sure that our seniors are cared for. We put funding in for additional food, not only for our seniors, but for our children as well. You are exactly right. Our seniors have been our backbone, and we're going to make sure that we take care of them, including not messing with Social Security. I've heard people asking me questions about that, but you have my full support, and I'll continue to support our seniors. And thank you for what you do for the great 2nd District.
Let me say thank you for your time and your energy. Keep the faith. I'm signing off at this point.
Mr. Dunlap sent me a message. He's having a problem with audio. Commissioner Powell, would you take over until we get him working again?
Sure. This is Commissioner Powell, and the next person would be Commissioner Mark Jarrell.
Thank you, Madam Vice Chair. Congresswoman Adams, thank you so much for being here today. I want to say, at the outset how much we appreciate.
Excuse me, Emily. There must be a problem. I cannot hear anyone.
I'm gonna hold off, Madam Clerk. I could hear Chairman Dunlap.
I'm trying to text him right now.
Okay, so I'll continue. But Congresswoman Adams, as I was saying, I wanted to let you know how much we as a community and your constituents appreciate your visibility, your transparency, and responsiveness during this time. It's your leadership has been amazing and outstanding, and I just really personally appreciate that. And with regard to your comments around your commitment to funding to states and localities, I think that is extremely important. We are trying on our level, as you know, to do a lot of heavy lifting in areas where we did not necessarily plan, but so that assistance is critical. And one of the things, as you know, and Commissioner Leek touched on this, but I need to touch on it again, because the biggest thing that I hear in my district, District 4, are from small business owners. And you and I have discussed this as well. And the thing that I look at, when I look at that first round, particularly as it relates to PPP, and the percentage that North Carolina received out of that package, I think we came in like 39th as it relates to
so Jarrell was after Leek. Okay.
As it relates to the percent total of the available funds as it related to PPP, we had so many small business owners that did not have access to those funds, or it didn't appear to have access to those funds. And I want to know if, from your perspective, if you think that we will, as a community, be farther up that ladder, have any adjustments been made to kind of even things out and level the playing field from your perspective?
Okay.
I can't hear.
Can you still hear me? Can you hear me?
Yes, ma'am. I can hear you now.
Oh, okay. So let me, first of all, thank you for your work. And you are exactly right. A lot of our business owners were left out of this process because those who had relationships, those big boys, so to speak, and big girls who may have had relationships with banks, were able to get ahead of the line. They should not have. But there was a first come, first serve process set up, which was not the spirit of what the Congress wanted to do initially. We received a lot of feedback from many small businesses, not just here in North Carolina and in Mecklenburg County, but across this country, who said the same things that you're saying. They didn't get a chance to get their foot in the door. Information was probably given out that shouldn't have been given out by some of the banking institutions who had been approved to actually administer these loans. And so I will tell you, sitting on the Financial Services Committee with Congresswoman Maxine Waters and having worked on the Small Business Committee with Nita Velasquez, we all got together and talked about what we needed to do, including the Congressional Black Caucus, and we were able to empower some of our minority banks, our CDFIs, our credit unions, our community banks. Those individuals, those institutions were not a part of the approved process initially, and so that's what we did. We did a set aside, you might call it. We carved out, first of all, $60 billion was set aside for loans that could be made by the smaller insured depository institutions like credit unions and so forth, who have assets under $50 billion. And so $30 billion of those dollars was specifically carved out for minority banks, CDFIs, credit unions, community banks with assets under $10 billion. And so then we also have a $10 billion emergency economic injury disaster loan. So there is opportunity now. In other words, the process was actually started or restarted on Monday, this past Monday. And I will say to you and to all of our listeners out there, if there are small businesses, mom and pops, whether you are an independent contractor, go back in. They should be, if your application was not vetted, then they should be picking up where they left off, and you still will have an opportunity. But I will say to you, check out some of these minority banks, the CDFIs. We have a list of all of the available institutions that have been approved in North Carolina. We have it for every state. And it will be on my website, and we can certainly send it to you as well. But so we tried to correct that problem because there was a lot of things going on that shouldn't have been. And that was unfortunate. Sure. But you remember some of the folks that got 10 billion, 20 billion sent the money back. All that was exposed, right. And I guess they were embarrassed about it, as they should have been. But anyway, I will say, put your application back in, and if it's in there and you haven't heard, then you probably, or you should be, because the process was restarted on Monday.
Well, thank you for that, Congresswoman. I've got two questions, two follow-up questions, and then that'll conclude my questions. I'll just listen for your remarks. The first question, and I'm just going to ask them both, and I'll let you respond. The question has to do with communities of color, and in particular, many of those communities have started a race where they're already 50 to 100 yards behind, and coming through this situation, I would love for the community to understand what the thinking is at your level and in the Congress to stand up those communities as we go through this, and with the understanding that we will feel the ripple effects for this probably, for the next 18 plus months. And, so I'd love to know what you're thinking and what mechanisms you're putting, the Congress is looking at putting in place. And then also, will you all be looking at any, because of the way the economy will change due to this, are we looking at any job training and funding coming to at the local level in regards to specifically job training and repurposing personnel moving forward? And that'll conclude my comments. And I do want to say thank you so much for being here today.
Well, thank you, Mark, for all of your work, for the support for your district as well, and for our entire county. I think what we try to do is there are many opportunities in Congress to put legislation through to do some of the things that you're talking about. We're still working through our committee structure to do that. As a matter of fact, it may be that we'll be headed back to Congress pretty soon. But we in the three committees that I sit on, for example, the Committee on Agriculture, the Committee on Small Business, and on Education and Labor, and I chair specifically workforce protections. And so one of the things that I'm focusing on right now is trying to make sure that our workers who are, at least we're using the word essential, and essential folks are out working, doing the work, risking their lives as well, so that those of us who can work from home are doing that, and so that we can close up our communities so that we can get a grasp on this virus. But we do have some bills that are circulating now. Whether or not those things will get through, we are getting ready to go through and the appropriation process, and so we're able to in that process put funding together. I would recommend to you, if there are specific things in the way of legislation that you think we need to consider, to just reach out to me, send me an email, and I'll have my staff look and see if we are not. We're probably signed on to a number of things. There'll be funding coming down to our states and local governments, and of course, you all will have some jurisdiction over how you use it. I think we need to do more in testing. I think we've got to get into these communities that are at greater risk, and we need to do that probably ahead of doing some other things as we try to get a grasp on this virus. So hopefully we're going to continue to work together and try to get some of the things that locally we need in our county as well as throughout our state. But understand that when funding comes down sometimes to the state, it will come into Raleigh, and that money is distributed through the various throughout the various counties and jurisdictions.
Okay, Commissioner Harden.
Thank you, Chairman, and thank you, Representative Adams. I can tell you that let me just turn my phone off. I represent South Charlotte, and we really do appreciate your leadership in Washington, D.C. One of the, South Park Mall is probably, certainly a big economic engine for our community, and certainly is for South Charlotte. And I hear often from people who work in those retail establishments and restaurants. And I know that you're a big champion for workers, as am I. And I'm wondering, I noticed that you were sponsoring the Every Worker Protection Act. Can you talk more about that and how we can provide clear OSHA guidelines as people think about opening up and going back to work, and what workers can expect, what type of protections they can rightfully ask for and feel comfortable asking for when they go back to work?
Well, thank you very much for that question, and thank you for your service. It's really important to know that we have people who are concerned about not only our workers, but our students and everyone else in our community. I mentioned to Mark when I was talking about about workers that we consider to be essential. I've always believed that essential means that if I am an essential worker, then I deserve to have essential protections. And I'm not sure that our workers are really getting that right now. As a matter of fact, I know they're not, because OSHA does not take the time to really comply, but then they also don't require or any kind of binding. And so what this bill will do, the every protection for every worker, means everybody who's out here working. And of course, currently, the standards and the guidelines that OSHA has are not binding. They're not enforceable. And so if they're not enforceable, then they will not protect our workers. This crisis that we're seeing right now is so new, and we just don't quite know a lot about it. What the law says right now, it does not cover airborne infectious diseases. And so it leaves our nation's workers at a tremendous risk. These are people who come to work, they go home, they go out in the community, and then they may be spreading things as well. So we want to make sure. So what this bill does is really help to protect them. It enables all of these frontline workers who, right, many of them work in our hospitals and our medical facilities, but some of them they drive the buses, they work in the grocery stores to keep the counters filled so that we can go and get the food. So When they go home, like I said, they have families, they have children. All of those people are vulnerable. And so if we don't take action through this bill and making sure that OSHA not only requires that, but we're talking about putting together a temporary, emergency temporary standard, which would allow them, if a pandemic, another pandemic, just we pray that that doesn't happen. But if it does, we want to be prepared. So that's basically what it does. It basically requires them to do it. There are about 10 different things in there that suggests things like it adds the language that will protect workers from retaliation. So if you are in a situation and you don't feel safe, you don't feel that you have the coverage that you need, then you can report it to your employer and they can't fire you. You can't retaliate and so forth. If you want to use your own protective gear, they can't fire you or retaliate against you for that. So it gives OSHA a lot of discretion to use citations to hospitals and other covered employers if there's a shortage of equipment. If the hospitals can show that, for example, they're making a good faith effort to purchase the protection for the people. So it basically puts that added coverage, if you will, and so that these individuals can be protected. Listen, one last thing I want to say about that, if these workers are essential, and if we believe that they are, and I believe certainly that they are, then we need to make sure that they have essential protection. And as far as I'm concerned, they need the PPEs, all of the protective gear, the masks, and whatever else they need. But they also need essential pay. And I don't want to get into talking so much about that, but hopefully we have realized as a nation, particularly during this pandemic, that we are going to have to pay people if we consider them to be so essential to help us, protect us, so we can stay home and the whole community can go undercover, so to speak. And they need to be paid. A lot of these workers make minimum to less than minimum wage, and I'm glad Mecklenburg County has done some things in improving wages. But I just think, listen, if I'm an essential worker, I deserve essential protections while I'm on the job, and I deserve an essential paycheck every week. Some of the members of Congress are talking about hazard pay. Well, and I do support that, but I think we need to make that hazard pay for every payday you get. You should get a decent salary, a living wage that is essential.
Well, thank you, Representative Adams. And I believe that those OSHA regulations are absolutely critical. So thank you for championing those. No more questions.
Okay.
Cowbell.
Commissioner Susan Rodriguez McDowell.
Thank you very much. And I want to add my thanks to Congresswoman Adams, because the access that you have given and the engagement with the community over these last 6 weeks or so, I mean, it really hasn't changed. The amount of involvement that you have given and invited our residents to, whether it's about, Black maternal issues or the CARES Act or HBCUs, workplace protections, equal pay, you have been in the forefront. And I just want to say I'm so proud of your leadership, that you are from Mecklenburg County and District 12. So, but I wanted to pick up on what you were just saying about the essential workers and essential pay. And one of the things that one of my constituents who spoke at our last meeting, her statement was that all workers are essential workers. And I really believe that she has a point there that, all jobs are essential jobs as they give paychecks, to working people. And so in that spirit, I just wonder, do you think that this is the time for a minimum wage that is a livable wage? Is this a time to talk about things like that, bringing that to the forefront as we sort of hit the reset button on many of the ways that we do business in this country? I wonder if you have any comments to make about that.
Yes, ma'am, I do. And thank you so much for your gracious comments. We not only appreciate the work you do, but I enjoy the work I do and representing the citizens here. And I've got to tell you, I do believe that all workers are essential. And I do think that COVID has pulled the cover off of a lot of things that we need to be addressing in our community and in our nation. I worked for 10 years in the North Carolina House to get a $1 increase. I wanted 10 or 15 then. It was in 2006. And you count back, and of course the federal government increased the wage. I think it went into effect in 2007. And look at how many years. And yet the price of food, everything has continued to go up except people's wages. And I think that is unconscionable, and I think it's inhumane, to be really honest about it. And I think we need to do something about it. We have a great opportunity now, especially since we are embracing people who are embracing other folks and trying to help with this pandemic and to help us get through it. The other thing is it's also uncovered the grave disparities, not just in terms of economics and the pay, but the disparities as it relates to race and ethnicity and gender. And you mentioned the Black maternal health issue that we're championing as well. So there are lots of disparities that I think we have an opportunity to step up to now as a community. We know we've always known, I think, who the most vulnerable people are. But now these things, the cover, if you will, has been pulled back. And I think this is a great opportunity. If we say we are about doing what's right, then we have an opportunity to do that.
I agree with you 1,000%. I think your comments are exactly spot on. And I really do hope that maybe if it's your office or Congress in general, can give us specific places where, now that these disparities have been exposed, I mean, not that they weren't already exposed, but they're exposed just even more, which just creates an opportunity for that reset button. And just if there's practical things that come to you that you can pass on that we could do at a county level or that we can help support for you, I would really appreciate that. And just one last question I wanted to ask you, and that has to do with with our food supply. Do you have any comments on how concerned we should be with our food supply as we see on the news, where these big plants are having outbreaks, and just wondering if you feel that our food supply is threatened?
Well, it certainly it is. I had an opportunity to talk to a reporter this morning about that and some of the things that are going on. Let me say up front that one of my H's is all about hunger and nutrition and making sure that people are able to eat. We have serious issues in our district, and of course the state, with so many people being hungry, and of course with COVID, that has exacerbated the situation. I do think we need to be concerned, and one of the things that I said is that if we can get people protected who work in these food supply companies, and we've seen a couple of them on TV that shut down, then if we can get that situation under control by making sure that people have the protections, that we do something to help those individuals get the coverage that they need, then we can put people back to work there. But you've got thousands of people from even one community who work in these food plants. So yes, I think one of the things they're saying is that Some of the varieties that we used to have when we go to the grocery store may not be there, as we look toward the next several weeks or so. So yeah, we should be concerned about it. We should be concerned that our farmers, for example, are having to pour milk out. They're having to plow up good vegetables and things like that. They don't have a way to store them, and we don't have, the schools aren't open, which is who they probably did have. They were probably big distributors there at the schools and at the the grocery stores and so forth. So yes, I think it is a concern. I'm also told that there's no shortage at this point, but I think in some products there will be.
Thank you so much. I'm sorry that I'm out of time. I had one more question, but I'll have to write to you about that.
Okay, please do. Just send it to
about immigrants and how we're going to take care of our immigrants and our undocumented. So thank you.
Okay, great.
All right, Congresswoman Adams, I want to kind of address the issue that it is now 1:55 and half of our commissioners still have not asked questions. What is your maximum time limit for us today?
I have about 15 more minutes.
Okay.
If that will help.
All right. So I want to be respectful of those who still have questions. If you don't have one, just pass or say you don't have questions at this time.
Well, I will make my comments shorter. I've probably been talking too much.
Well, we appreciate that because we asked the question because we wanted a response.
All right. Okay. So let's get everybody's question in. How about that?
Right. Commissioner Scarborough.
I'm good. I have no questions.
All right. Then
Good to hear your voice, Commissioner.
All right. Commissioner Fuller.
Thank you, Mr. Chairman, and thank you, Congresswoman Adams. I want to just thank you for your service to Mecklenburg County and the citizens, residents of Mecklenburg County. Thank you for your leadership not only here, but in Washington, where we have seems to be leadership is scarce in Washington. And so we are really thankful and privileged to have you as one of those leaders in Washington for us. And, you can't underestimate the influence that you personally have in Washington to help advance some of the issues that are important to our community, to bring resources back to Mecklenburg County. I'm just so grateful for your service, for your presence on our behalf in Washington. It's really important, and people often don't appreciate just how important your leadership is. I just want to ask really one question. This whole thing, as you just mentioned a few minutes ago, has shown up the disparities and inequities in our healthcare system that we say we have the best healthcare system in the world, yet when the need comes, we can't seem to get things that are needed to our people. And I'm glad you're up in Congress helping to solve that problem. I really appreciate your focus on getting funding here locally so that we can get help to our people. But my question really has to do with reopening our economy, reopening our society. And Governor Cooper has outlined a 3-phase plan to get North Carolina back open again. And I have to say, I appreciate his leadership as well in helping us through this pandemic and having a rational process for us to reopen. But he said that what we're going to need is we're going to need to have 5,000 to 7,000 tests per day from about 2,500 or 3,000, which is where we are now, that we're going to have to increase tracing and have more tracers in our state. We now have 250. He wants to get that up to about 500. And then when it comes to PPE, the personal protective equipment, that we need to get that up to a 30-day supply, and we're not there yet. So I wonder if you could tell us a little bit about what kind of funding there will be for us to reach these measures that the governor has set to reopen the state, because to the extent that we don't get to those levels because of funding or sourcing needs, it's going to delay when we can reopen. So I wonder if you could talk a little bit about that, about what kind of resources we can deploy to help us get our economy and society back open again.
Well, and thank you very much for your question, and thank you for your service as well. It's a very, this reopening is, I think, an issue or a concern of most folks for various reasons. But the health and safety of our residents are paramount. And I believe until the virus is going to dictate a lot of when we're able to reopen. And so we have to get it in remission. And I think then we can begin to really reopen the economy. In terms of funding, though, each of the bills that we passed already, which there have been 4, we have included funding for testing. Our speaker has said testing, testing, testing. I believe that that's critical, because when you think about how this virus is spreading, it's those folks who, it appears at least, who are what do you call it, who are unsymptomatic and who just don't know that they have it, and yet they spread it. So I think that we've got to test now. You know, it's really interesting, because this morning I was talking to Dr. Williams with Novant, and they've got a program they're rolling out, Mask the Community, which I think we've got to make sure that we follow those steps. We've got to keep our social distancing. We've got to make sure that we are masked up. That is so important, so that we have, as we have to go out to have our gear. But we will be, even as we are planning for CARES 2 or 2.0, whatever we're calling the second CARES package, that we want to look at testing, tracing, and trends. Those are, I think, 3 important considerations that we have to look at as we move forward. We need a major increase in testing capabilities, diagnostic, antibody as well. We've got to identify and isolate the track new cases. And I believe that we got to begin by, we know where the most vulnerable communities are. And I think that that's a place for us to start. But we also have to do this in concert with our public partners as well. So it's got to be a public partnership. We can involve our universities, our lab partners, our counties, et cetera. But I do think we have to boost up our public health workforce and the ability to track, as you said, because contact tracing is really going to probably be effective at containing any new outbreaks, but it does require a lot of people. It's going to require a lot of funding, and know that your Congress realizes this. And so as we are preparing to put this CARES 2 together, we are not only seriously talking about it, but we're going to make sure that we are able to provide support. We're not going to do it all, but we'll be able to do some of it.
Thank you so much for your service. Thank you.
Thank you.
Okay, Commissioner Copham.
Thank you, Mr. Chairman. And Congresswoman, thank you so much for spending time with us. And I reiterate and support what my colleague said about how you're in the community. I thought Commissioner Susan Rodriguez McDowell, probably said it best. And I would just add also your staff is always available if we have questions. And thank you so much for training them to be that way. And they are a great reflection of you. But so I just want to reiterate that. I will keep my questions short. And I do want to agree with my colleagues about the smallest businesses. It seems like whenever we hear first come, first serve, to me, that's like the kiss of death to the smallest companies, because they just cannot get things done quickly. They don't have the people, they don't have the procedures in place, but they are the ones who need the support the most. I don't know if you could just keep it in your mind as future funding, if they could set some aside for those micro businesses that are, maybe under 10 or 15 people, because they just can't compete with the ones that, have been around for a long time and have, staff to get all this stuff done in relationships with banks and attorneys. So I just ask you to keep that in mind. I also ask you to keep in mind mental health. I'm very worried about how this social distancing and isolation is affecting so many of our residents, especially our senior citizens and our children. Our children are confused, they miss their friends. I worry about the kids that should be graduating, should be having a great year, and there's no prom, there's no graduation, there's no celebration, and they're missing their friends, and many of them, their college life could be in jeopardy. So I just ask you to think about mental health. This pandemic has really highlighted inequities in our community that we already know about, but we can just see them. They're just light shining on them. One of those is Wi-Fi. I worry about our children who do not have access to Wi-Fi like they need for their schoolwork, and also college students. I talked to a homeless CPCC student who, where he is in his tent, he doesn't have access to Wi-Fi, and it's really, wearing on him. So I ask you to think about, when we get through this, how do we, take these inequities and try to improve them for going forward? And I guess the only question I have for you is, how can we help you? What can we do, county commissioners and as people in the community, to help you in your efforts? That's what I want to know. Thank you. That concludes my questions.
And thank you very much, Commissioner Cotham. And thank you for your service. And you are exactly right. I will tell you that the spirit of the first CARES package and what we did with PPP was not intended to be first come, first served. We discovered that was a procedure that the Mnuchin folks put in place. And that was just not the spirit of what we intended to do in the Congress. And that's why when we put this emergency piece back for PPP, that we included those dollars, including the carve out of $60 billion for what we consider to be the businesses that need it the most, the mom and pops, the small businesses that may only have 2 or 3 employees. So I will say again that they need to look at these institutions that we have empowered to help them, the credit unions, the minority banks, and so forth, the CBDIs. They are in a position to help, particularly if you don't have a banking relationship. And then you are exactly right. This pandemic is certainly taking a toll in terms of mental health and on our children. How you can help me is what you're doing right now, giving me the feedback in terms of what we should be including. Mark mentioned something about training. We are including additional workforce training for the jobs of the future, and there's probably going to be a shift towards automation. So we do have to prepare our workforce for those shifts. So giving me the feedback in terms of what you think we need to be doing as a Congress, as we are, I just believe we're going to have some monthly appropriations for folks. $1,200, all right, that's all right, but that's not going to be enough. If you live around Charlotte, you can't even pay your rent for that. But the point is, this is going to be an ongoing process for us. So having the feedback from you as my constituents certainly helps me to do that. If you have information on your website that you think we can share on ours, those are things that will be helpful as well. We'll be sharing with you what we have, and if you'll pass that information along, that will certainly get us a little further along. And thank you so much for your service.
Thank you, Congresswoman.
All right, Commissioner Powell.
Good afternoon, and thank you for being here, Congresswoman.
Yes,
I'm busier than ever, as I'm sure all of us are. But the one thing that troubles me the most, it's kind of related to what Commissioner Cotham said, is people are feeling hopeless.
Yeah.
Much frustration, fear, anger. People are reaching out for help. They try to get help through every place that we offer, and either they're put on hold or they can't get through, and they feel like they're calling 911 and it's a real emergency and they're not getting any answers. And so I'm concerned about the mental health, hopelessness. And, you know, I watched some of the briefings from different governmental bodies, and I'm not hearing any kind of hopefulness. It's like, well, we all have to work together. We do have to work together. We are working together, but I think we need to expand however we do this. And I hope we can do it at the federal level all the way down. Expand responsiveness. You know, hospitals aren't closed on weekends. We can't say, oh, we're going to close down on Saturday and Sunday. Mm-hmm. And it's very frustrating for government to shut down on Saturday and Sunday. And that's what people feel like. So how can every level of government expand responsiveness and customer service at this time? And you know, can we, same as Commissioner Cotham said, let us know how we can help, because there's so many things that we want to help with. You know, how do we help the nation's farmers? How do we help North Carolina farmers? How do we help small businesses? And it is true, a lot of the smaller businesses don't have staff and personnel to go through the obstacle course of some of these forms that people have to fill out, if they can even get in. And so the bigger companies are at an advantage right from the beginning. And all the other questions that the commissioners asked are on my list, but I'm just really concerned about how do we communicate hope at this time? What gives you hope?
Well, I am, in spite of all that's going on, I just believe that there's going to be a better day. I am an optimist, and you know, and it's hard, I think, to be optimistic when you look around and you see all this that's going on. People are not only, billions of people are out of work. Millions of people have lost their lives, and yes, it's a kind of a depressing environment. So I think we're going to have to put more money in. I've got to go back to Commissioner Cotham's concern about mental health. You know, this pandemic is weighing on all of us. But I think as the leadership of our communities, we've got to continue to not only hold our heads up, because we've got thousands of people. I've got 800,000 plus in Mecklenburg County that I have to be concerned about. And so the resources that we can make available to them by putting information out, by staying in close and constant contact, I think will really help people. And we've got to encourage people that, and one of the things I'm trying to encourage people to do is, while it's difficult to be separated from your families and friends, you know, this is not going to, you know, it reminds me of the many Bible verses that I like, which, you know, remind us that trouble won't last always, and that weeping may endure for a night, but joy will come in the morning. And I just believe that if we continue to do what has been required of us in terms of the social distancing and all those things. And if we try to make those resources available to people that we know about, share the information as it relates to job opportunities, funding opportunities. So many people are out here helping our neighbors to make sure that they are fed every day, our seniors to make sure that they're fed. So I think we're going to have to continue to work together as a community, as an elected body, as appointed bodies to make sure that whatever information we have that we can share, whatever resources we have, that we'll have the opportunity to share them.
Thank you. And just let us know how we can help you push for OSHA.
Oh, yeah. Well, you can write, I'll tell you right now, write, tweet, text, whatever it is you do to members of the Congress, particularly members of the committee that I chair, Workforce Protections. I'm not sure how many folks we have signed on that bill yet, but we have quite a few. We need to also, let's understand that this pandemic is not a partisan issue. It doesn't make any preference to whether you're Democrat or Republican or whether you have no party affiliation. It is a life or death issue. And I think we have to continue to look at it that way and make sure that we reach out to every single person who will have a vote in the U.S. Congress.
Thank you. That concludes my questions for today. I appreciate you.
Thank you.
Congresswoman Adams, out of respect for your time, it is 2:15.
Did we get everybody?
We did, except for the fact I want to ask just one question.
Oh, well, clearly, Mr. Chairman, you have the floor.
Well, I'm going to ask one question, and then I'm going to give you an opportunity for any final comments.
Okay, great.
So you've gone where my concern is, and that is the fact that this virus has uncovered a lot of things.
Right.
It has uncovered many disparities that you see throughout this country. The urban and rural divide, the issue with the internet not being available everywhere, the issue relative to health. My question is, how likely is it that Congress will, after seeing all of this, begin to send money to the local communities to address these issues?
I can tell you, Commissioner, without a doubt, it is absolutely very likely. As I said before, when you look at broadband and all the other things that we need in our community, it's not just in our community of Mecklenburg. It's all over this country. It's in the red states and it's in the blue states. And so the members of Congress realize that, because just as you have reached out to me and other folks in the community have reached out to me, they're reaching out to all the members of Congress. I can tell you that my leadership right now, we are working on CARES 2, 2.1.0 or whatever they're calling, whatever the number they're putting behind it, but it is the second CARES package. That's the first thing that we're looking at doing. We're going to make sure that we include the funding because we understand that now all children don't have access. The access that they need, for example, to do their schoolwork at home. They don't know about that, and so we also want to make sure that we make sure people are fed, that we have the food that we need, and so food security. Is since it's administered by the county, we want to make sure that you have the funding to do that. All of the things that you have raised with me today, we have been discussing over these few weeks, trying to work with this second package, because we know that what we've done is not enough, and it will not be enough to sustain our communities. And so I'll guarantee you that's the first item on the agenda, because it should have been on this package that we just voted out last week, the emergency package, because listen, you're missing a lot of, you're not getting your revenue. You're not getting the taxes, and everything is collapsing, and you're bleeding, and we understand that. And like I said, it's not the blue counties or the red all of us, all counties across this country are having some of the same difficulties. And so it is very likely that is going to happen, because not only have we talked about it, but we're going to be about it, and we're going to do the right thing because it's the right thing to do.
All right, I'll give you just a minute. Any final comment?
Well, first of all, let me thank you for allowing me. And I'm sorry, I've tried to learn a little more about technology. And that's one thing that COVID has taught me. I don't have my staff in my house to help me maneuver things. So I've had to kind of learn on my own and with some assistance virtually. But thank you for the opportunity. Thank you for what you do for our citizens and for being a voice for them. That is so important, that people understand that while things may look gloomy and things look really pretty bad right now, but a change is going to come. And we're going to get our economy back and up. And again, I just want to emphasize to all of those small businesses out there. You know, I had a small business myself, which is about 30 years old. Now, I understand the struggles, and we don't want to see people shut down. So because when the economy comes back, we want you to be able to resume your stores and whatever operations you have. So take advantage of the funding. And if you're having difficulty, reach out to my office, and we can help guide you through. But you also need to, I would say, check out some of those organizations, those banking institutions that we have set aside and empowered to work with our smaller businesses, because they have better relationships with them. And that's really, I think, a plus in your favor. We've set it aside, and we want you to use it. So listen, COVID is not going to keep us down. But I would say to the citizens and to this board, you are a tremendous board. And Mr. Chairman, when we get an opportunity to get back together in Washington, we're going to go to the dining room again. I know you like to go there. I do too. I miss it because I'm now having to cook for myself every day, and that's I'm getting a little tired of that too. Well, even though I'm a good cook. But thank you all so much, and to all of the citizens in Mecklenburg County, please continue to use my office as a resource. Send us an email. Go to my website, adams.house.gov. There's a lot of information on there that will really, I think, help you to navigate this process. And if we have to personally help you do that, we'll certainly do it. My office is ready to assist in whatever way we can. And you know, we can address this issue. I'm still going to be working on my H's on housing, healthcare, and higher education as well, and all the other things that we need to do. But healthcare is going to be important. I hope I hope that our state government, our state elected folks are listening, and that they will expand Medicaid. Too many people are without health insurance, and of course, COVID has exacerbated that as people have lost their jobs. That was connected, where their health care was connected. So we've got a lot of work to do, and we're prepared to do that. So thank you all so much for what you do, and maybe the next time we'll have an opportunity to meet face to face.
Well, I certainly look forward to us going back to the dining room.
Yes, sir.
But let me just say on behalf of my colleagues and myself, how much we appreciate your leadership in Washington for representing us and representing the other citizens of Mecklenburg County. And so I want to thank you for taking the time to to allow us to just engage and catch up and figure out what it is that we can do to make life a little better for our citizens. So let me remind my colleagues that you should not disconnect after we adjourn because at 2:30 we start our regular policy meeting. So at this time, I will entertain a motion to adjourn this special meeting.
This is Commissioner Powell, so moved.
This is Commissioner Jarrell, second.
Okay, it was moved by Commissioner Powell, seconded by Commissioner Jarrell. Roll call vote. Commissioner Cotham, how do you vote?
Aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Yes.
And the chair votes aye. Meeting stands adjourned until 2:30. That's about 5 minutes.